Hello, everybody. Good afternoon, and welcome to our weekly media briefing with Montgomery County Executive Mark Elridge and also Public Health Update. I'm Lorna Virgilla, Hispanic Public Information Officer for Montgomery County Government. And joining us today is Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, as well as Ms. Kimberly Townsend and Mr. Sean O'Donnell, both from the Department of Health and Human Services. And today we have two special guests, Gustavo Torres, Executive Director of CASA, as well as Bill Tompkins, President and CEO of the Montgomery County Economic Development Corporation. Members of the media, please use the chat for the Q&A portion of this presentation, as well as to request permission to record. And with that, good afternoon to you, Mr. County Executive. Welcome.
Good afternoon to you, everybody else as well, and thanks for joining us today. A lot to talk about. As one of the concluding events of Hispanic Heritage Month, we had a lot of good events over that month. I was proud to stand with County Council on Tuesday to honor some of our outstanding Latino leaders. I also want to thank and acknowledge Lorna Virgilla, our weekly moderator, and Hispanic Public Information Officer for her service to the county. Every week, Lorna produces her own radio show for our Spanish-speaking communities, and over the past month has led our social media efforts to highlight over 50 Hispanic and Latino employees throughout our government. As part of Hispanic Heritage Month, I've been touring Hispanic businesses, I think you all know that, in our area, to learn how our county continues to change and grow, and also what role we can play to help people to successfully grow here. I've talked with some of those on some of those visits with the business folks, and we've talked about those visits in more detail on press conferences in the past, so I'm not going to go through them all again. But I just want to acknowledge all the folks in this county who are working and trying to grow their businesses here. This month's celebrations have also included Salvadoran Independence Day Festival at the fairgrounds and a series of Dance for Life competitions in Wheaton that's going to conclude with a championship event this weekend featuring salsa dancing. And that's going to be at the Marion Friar Plaza for any of you who might want to come out and either dance or observe it. As we celebrate this community, we also have to recommit ourselves to addressing challenges facing our Latino communities. As we mentioned last week, Daca recipients, or as we call them, dreamers, people who came to the U.S. as children without proper documents, are facing an uncertain future. Again, a recent court decision sided with the 2021 ruling out of Texas declaring the program unlawful. That decision by a three-judge panel stands in direct contrast to our declaration put into place almost 1 year earlier by the Department of Homeland Security, giving DACA arrivals federal protection from deportation. Following last week's decision, the president released a statement detailing his disappointment that this continues to be a partisan battle. In Montgomery County, as you well know, many families are feeling the weight of the DACA news. While there have been many steps forward for dreamers, like the 2012 state law that allows dreamers who live in Maryland to qualify for in-state college tuition at public schools, this decision feels like a step back and has potential to tear families apart. Joining me today is the Executive Director of CASA Maryland Chapter, Gustavo Torres. CASA has been a wonderful community resource here in Montgomery County. I've worked with them for more than 2 decades, most recently standing up for renters' rights and supporting our rent stabilization efforts. Gustavo's been a leader of this organization for 30 years now, and he's an incredible advocate, resource, and friend to the county. And I want to thank and appreciate his service, and I'm glad he's able to join us today. So I'm going to turn it over to you now, Gustavo.
Mr. County Executive, thank you very much for this opportunity. I really appreciate that you bring these very important issues because they are in the core of who CASA is. And I just want to mention a little bit about DACA and how upset we are with the decision because it's impacting almost a million youth who have been making a great contribution in this nation. In Montgomery County, in Maryland, in the Washington, D.C. area, we have thousands and thousands of these extraordinary leaders who actually, they save us with the COVID because many of them are doctors, nurses. They are people who are in the healthcare system making a contribution. And now we are in the middle of this crisis again. I believe right now that Congress and the White House have a big responsibility to make sure that we finally pass citizenship for these great leaders, because we believe that is the only solution that we face right now. The only solution that we have is that Congress come together and finally pass citizenship for our kids, our families. You know, currently we have right now 50 senators. We need 60. We have 50 right now. All of them are Dems. We hope that we finally have 10 Republicans who are going to join us and pass immigration reform for these extraordinary leaders in our community. White House is ready. The White House, we had a conversation with the White House and they told us that they are ready to sign any legislation that I come to the desk. So we need to push. We are going to work really hard to make sure that we pass finally citizenship for these great leaders in our community, because they are making a great contribution, and we believe that the minimum that we can do is to respond to them. The minimum that we can do is to pass citizenship for our families and for these particular kids. So that is number one that I want to describe. Number two, I want to describe what you just mentioned, Mr. County Executive, the housing crisis that we face in Montgomery County. And the reason we have this crisis is because, you know, too many Montgomery County families are spending more than 50% of their household income on rent. Because of the high cost of the rent, these families are living in paycheck to paycheck. And this is totally unacceptable. That is creating a crisis in our county. And we believe that, you know, housing is a human right. And that is the reason we are working with you and working with the county council to make sure that we finally pass a legislation to have a rent stabilization in our county. Is so very, very important. We believe that limit and reasonable, you know, rent increase are the right thing to do, because it's going to be a win-win situation for our community. We believe that, you know, landlords must have a fair profit, but at the same time, we believe that it's very important that our families, our workers can live in this country, can work and live in this county. And it's so very important that we make a decision, and together with the county executive and with the council, we resolve this crisis. I hope, and we hope that together we can resolve this, because we are speaking about the dignity of the workers. We speak about the condition of the workers who are making a contribution in this beautiful county. You know, they are people who are saving us from COVID and other different crises that we have right here in Montgomery County. And I'm very sure that working together, we are going to accomplish that. So thank you very much, Mr. County Executive, for giving me the opportunity. And I'm happy to answer any question that the media have about these very two important issues. Thank you.
Thank you, Mr. Torres, for joining us today and for this opening statement. Members of the media, we're going to open the Q&A portion right now for this particular topic. Stephanie, I know you have questions. If they're related to this, now is the time. If not, we can wait for later on. So members of the media, any questions regarding this particular topic at this moment? I'll give you a second or two. Any questions for Mr. Gustavo Torres from CASA?
I noticed a hand from Heather.
Yes. Hi,
Okay,
Gustavo.
Heather Curtis, go ahead.
Hi, Gustavo. I'm wondering two things. You talked about Congress coming together to pass citizenship. Obviously, you guys have been very vocal advocates for undocumented people, for new immigrants. I'm wondering, will you be part of any effort to craft some sort of legislation or to go before Congress? And also wondering the same thing, will you be part of any effort to pass rent stabilization so people can afford to stay in the county?
Absolutely. The answer to the two questions is yes. We currently are in Capitol Hill advocating, lobby, you know, knocking doors, speaking with legislators, speaking with the White House, because again, we are speaking about how critical it is to make sure that we protect these great leaders in our community. Again, remember, in Montgomery County, we have thousands and thousands of these leaders who are making a contribution right here in our county. So that is the reason why we are focused, very diligent, not only to pass citizenship for Daca recipients, but also for our families in general. Remember that we have around 11 immigrants who are undocumented, and it's time to make sure that we pass comprehensive immigration reform. But one more time, the only way how we are going to pass this is that we come together. We need 60 votes. White House and Dems cannot do the work by themselves. We need to work together. I remember that in the past, the two parties come together and pass very important legislation, immigration legislation. So I really hope that we are going to do it again. We are going to keep doing that. And related with the rent stabilization, absolutely, absolutely, we are going to keep working. We have been working with the county executive. We have been working with the county council, and we hope that we are going to pass rent stabilization because I described before, we are in the middle of a crisis because many people in Montgomery County, many families are spending more than 50% of rent of the household income on rent, and we need to resolve that issue. Thank you.
Gustavo, one follow-up. So just anecdotally, my neighbor came here from El Salvador during the Civil War. Very hardworking man, works overnight at Giant on the weekends, never complains, but says, you know, I'm going to probably move back to El Salvador in the next few years. And he said, I know people who are doing that because we just can't afford to stay here anymore. And I'm wondering, you know, is that a concern, and how might that impact Montgomery County if immigrants start going back to Central America because they just can't afford to live here?
Yeah, no, it is a big problem. It's a very serious problem because we have the responsibility right here in our county, and that is my CASA viewpoint, to make sure that we welcome everybody regardless of race or color of skin, of immigration status. We believe that is very important, and I know that is the same philosophy of the county executive and the county council. We truly believe that, and it's so very important that we find ways to make sure that people who are making a contribution right over here can live in Montgomery County. Because if you make a contribution, you work right over here, you pay taxes in Montgomery County, and you cannot live in Montgomery County, we are not doing the job that we're supposed to do as a leaders, as a policymakers, and as a community organizations. We are not doing the job that we're supposed to do to make sure that those people feel welcome. And it's not only feeling welcome in terms of, yeah, we love the immigrant community, we love people of color. It's also in terms of the economic situation, in terms of to make sure that people are going to live with dignity right here in the county. Thank you for the question, Heather.
And one more question, if I may.
Sure.
You know, so my neighbor worked at Giant all throughout the pandemic. He was scared. He's older. He's diabetes, but he worked there, and a lot of his, you know, colleagues are new immigrants or immigrants. And you know, how might that affect the county if a lot of these people who are essential workers and who are kind of, you know, unsung heroes in the pandemic and other places leave? Will we have even worse labor shortages?
Heather, thank you very much. This is a very important question, but you know, in addition to that, I just want to tell you that we are very concerned about the health condition of our families. We have so many people in Maryland. It's around 300,000 people who don't have health insurance. The great majority of them are Latinos and Latinas, okay? So we have the responsibility, and we are working actually with the county executive, and also we are going to work in Annapolis to make sure that we address that issue of health, because we also believe that healthcare is a right, it's a human right. And we believe that in Maryland and in Montgomery County, everybody should have health insurance. So we are working right now, we are very lucky that we have the new person who is the chair of the health committee in Annapolis. Is a Latina, is, you know, Delegate Jocelyn Peña-Melnick. She is going to be the chairperson, and we are working with her to make sure that we pass healthcare for all, because it's so very important, not only to make sure that we identify the best way for people to be with dignity right over here, but they do have healthcare. So we are working on that as well. Thank you for the question, Heather.
Thank you so very much, Gustavo. I appreciate it.
Absolutely.
Thank you. That was Heather from WMAL. Two more questions from reporters for you, Mr. Torres. Michael Hernandez from MCM. Good afternoon, Michael.
Good afternoon. I have a question in Spanish for Gustavo. Gustavo, si nos puede...
Make it bilingual.
Go ahead, Michael. Go ahead, Michael, in Spanish. No problem.
¿Puede hablar en español sobre la indignación que los Dreamers sienten en referencia a la reciente decisión judicial? Por favor.
Absolutely. He's requesting me if we can speak in Spanish about how DACA recipients feel about the decision in court. Michael, te puedo decir que la gente, nuestra comunidad, está tremendamente enojada porque es una manipulación permanente. Hace exactamente 10 años el presidente Obama pasó el DACA para nuestras familias, para cerca de 1 millón de jóvenes que están en este país, que sus padres, que son desde nuestro punto de vista los soñadores originales, los trajeron acá para buscar un mejor futuro para ellos. Y resulta que han hecho una contribución extraordinaria desde salvarnos en la pandemia hasta trabajar fuertemente en nuestras comunidades, y ahorita los estamos tratando casi como criminales. Esa es la rabia que nosotros tenemos, ese es el dolor que nosotros tenemos, y por eso vamos a seguir en esta lucha, porque este dolor y esta rabia que tenemos la tenemos que convertir en lucha para de una vez por todas lograr la reforma migratoria y la residencia e igualmente la ciudadanía para todos los recipientes de DACA. Muchísimas gracias, Michael, por tu pregunta.
En efecto, un follow-up, Gustavo, ¿qué tipo de esfuerzo está haciendo CASA para ayudar en este esfuerzo, en esta lucha que mencionaste? Sé que dijiste que han hablado con la Casa Blanca.
Sí, Michael is asking about what efforts CASA is doing to make sure that we fight for immigration reform and for citizenship for DACA recipients. Yes, estamos haciendo muchas cosas, Michael. Entre ellas estamos, en la semana pasada estuvimos en una marcha, estuvimos en desobediencia civil en frente del Capitolio, donde demandamos que los representantes de una vez por todas pasen la reforma migratoria. En este momento estamos cabildeando en el Congreso, estamos hablando con la Casa Blanca y vamos a continuar en esa dinámica. Y a propósito, no es solamente CASA, tenemos una red nacional de diferentes instituciones que están trabajando para luchar y para lograr que finalmente pasemos la ciudadanía para todos los soñadores. Muchísimas gracias, Michael.
Perfect, thank you.
Thank you, Michael. Up next, Judy Hertz from the Greater Olney News. Good afternoon, Judy. Also questions for Mr. Torres.
Yes, good afternoon. Thank you, Senor Torres, for answering these questions. I worked for the Gazette for 25 years, and we monitored the immigration issue very closely over all those years. One of the things we did about 25 years ago was send me and a photographer to Central America when we saw things starting to change in Montgomery County. And we lived there for several weeks, and we talked to the families of people in Montgomery County about what life was like and why they were leaving Central America. And we walked the path with them, and we did a special section on what we called the changing face of Montgomery County. In those 25 years, has the climate for immigrants gotten better, worse, stayed the same? Is it possible for you to assess that?
Judy, I remember 25 years ago what you did. I only was 5 years old, but I do remember that.
I was too only 5 years old.
That was very, very powerful, and I really appreciate what you did, because what you did was educate Montgomery County residents about immigrant issues, and I really appreciate that. But in fact, it's a lot of changes that has happened, since then, including, I just want to mention another very, very important issue that is happening right now, Judy, and it's related with the climate crisis, the crisis that we are facing in our countries. Many families now are living from Central America and actually from Colombia, my country, and from Venezuela, not only because the political realities that we are facing right over there, but right now because the climate crisis that we are facing. People don't have any more places where they can cultivate, the maize, the food. They don't have anymore. So that is the reason why they are coming here. And then the environment is horrendous, in part is because we have the previous administration that we have created very difficult environment for our community. When they started to accuse us that we are criminal, that we are rapists, when they started to accuse us that we don't love this country, that is still a lot of feelings and a lot of attacks that we face every single day, and not only from crazy people. Now you see in Capitol Hill, people who used to support the immigration reform, now they are attacking our community. So the situation is very difficult right now, and we are going to continue working on this until finally we pass comprehensive immigration reform. Thank you, Judy, for asking that important question.
Thank you.
Thank you, members of the media. Any more questions for Mr. Gustavo Torres? Going once? Twice? Executive Director of CASA, Gustavo Torres, thank you so much for joining us this afternoon. And
Lorna, thank you so much, Mr. County Executive. Thank you very much for the opportunity.
thank you. I toss it to you, Mr. County Executive. Can you please unmute? Unmute, Mark.
I'm doing it.
There.
Takes a while to get to that button. Okay, so I just wanted to add just a couple of points to Gustavo's comments about housing, because I think they're really important. The fear of a loss of affordable housing is very real. And just to give you, Montgomery County story, that's true throughout the region. Arlington, other jurisdictions experienced the same thing. But in 2000, Montgomery County had almost 45,000 naturally occurring affordable units. That means they weren't controlled by rent stabilization or any contracts. They just were in the marketplace, and they were in the marketplace at prices that were affordable to people. Fast forward 20 years, and half those units are gone. That's 2020. And now they're projecting that of the remaining 20-something thousand units, this is Park and Planning's projection, between 7,000 and 11,000 of those units will be gone by 2030. And that's not even including the effect of these massive rent increases, which nobody assumed. I mean, people have made their projections based on normal inflation, and we now have at least 1 year of abnormal inflation, and we don't have any certainty when inflation is going to go down. So we really do stand the chance of losing a major portion of what's affordable in Montgomery County. If any of you are thinking, well, you got this great MPDU law, I got 6,700 MPDUs in Montgomery County. When a new development occurs, we get a whopping between 12.5% and 15% of the development as moderately priced dwelling units. And moderately priced dwelling units only serve people between roughly 60, 70, 75% of area median income, which is roughly $60,000 to $75,000. And so we run the real risk of losing housing for the people who need it most, whose wages are likely to go up the least, and it will have impacts on the business community. We have a labor shortage due to COVID now. The last thing we need is a labor shortage forced by the outmigration of the workforce in Montgomery County. So hopefully, whether you're on the commercial or business side of this equation, or whether you're a county resident concerned about the well-being of our neighbors, we all have a stake in maintaining the affordable housing here. So I just wanted people to ponder that. Coming back to our the briefing, we've been doing a lot of work in terms of trying to promote business in Montgomery County, and also to help grow businesses in Montgomery County. When we first came in, we were able to get past local preference legislation, which gave local preferences to businesses bidding on opportunities to do business with the county government. We gave point preferences for local businesses. We gave price preferences for local businesses. And one of the major reasons for that was we knew that if we give a contract to a local business, the chance of their employees living here is greater and paying taxes here, of the owner living and paying taxes here was greater. We get the property taxes. In other words, while we are putting out money for the contract, we're also getting money back from businesses who do business in the county. And we don't get that when we give a contract to somebody who's out of county, and all those dollars wind up going out of county. So that was one of our first efforts to try to address creating more opportunities for business involvement. So along those lines, this week we had a procurement fair for business owners interested in applying for contracts with the county. The fair, which drew about 150 people, was held in the East County, and it was aimed at giving minority-owned businesses an opportunity to learn more about opportunities in the county. I want to thank our procurement director, Ash Shetty, and his team for organizing the event. And I'm really pleased that we're using our dollars in procurement opportunities to help these local small and minority businesses succeed. We need to keep more of our money in the county, and we need to keep growing more of businesses that are local county businesses. So we're focused on that. We're going to retain that focus. Industries like life sciences are fast growing, leading to new construction and the conversion of office buildings into lab space for bioscience work. And I'm really excited about that because there were questions about office space conversions being viable when we were originally looking at empty office spaces, but we found creative developers who've been able to convert regularly built office buildings into lab space. And that's a big deal for bioscience because if we don't have to build the whole building, we actually have buildings in more than one that could undergo this kind of transition. And added to that, we're adding more than 3 million square feet in the county that's being built for lab work already. So there's a lot going on. Montgomery County's own alcohol beverage services is riding the wave of a craft beverage boom and redesigning stores with customer-friendly upgrades. The department was just recognized with the national honor, the Best Practices Award from the trade magazine Sideways. Montgomery County ABS crews stood out when compared with similar departments on a national scale. And I'm proud of their work and I want to congratulate them for their success. And I was just told that we're likely to see yet another distillery coming to Montgomery County. So that sector is also beginning to expand and grow, and I'm excited about that as well. This week, Montgomery County Economic Development Corporation launched a new marketing campaign showing the best of Montgomery County to the world. We have an incredible success story to tell. We've seen our bio and life science sector boom, our incubator companies grow, and new companies relocate here, and our hospitality industry is rebounding from the impacts of the pandemic. It's important to both our businesses and our residents here, as well as businesses across the country who may be contemplating relocating, to understand the vibrancy and strengths here in Montgomery County and to understand that we want to help them succeed. So I'm going to turn this over now to the new Executive Director of the Economic Development Corporation, Bill Tompkins, to discuss the Be Next marketing campaign.
Good afternoon, everybody. Pleasure to be here. And I'm going to share a couple of comments with you and show you a little bit about a campaign that is launching any day now. You know, I grew up in the DMV. Can you see my screen? Hopefully you can. But I grew up in the DMV, and it is a great, great place to be. But it's also great to be here in Montgomery County. I've spent 40 years here. While I was born across the line, 40 years is a long and a good time. And there's a lot happening here, but we don't talk about it a lot. We know that Maryland is open for business. We know that Montgomery County is open for business. But quite often, people talk about the glass being half empty. And my belief and our belief here is that it's more than half full. The challenge is we don't spend enough time telling the great story about the business opportunities here in a consistent way, in ways that everybody here can identify with. If you take a look at what's going on in the region, right here in the western part of Montgomery County as we speak, how many of you have gone down to look at that new headquarters that Marriott has moved to, making a longer term commitment to Montgomery County? There's another building going up down the street, Choice Hotels, moving down the street to a brand new facility. And they had the option of going a lot of different places. Even somebody who's on this call, Fox 5 down on Wisconsin Avenue, they came on up and now they're part of Montgomery County. Go over to Silver Spring, 2 immigrant kids who went to Montgomery Blair High School, went out to Silicon Valley, had a great idea for starting up a high-tech business, and they looked around, they started it, and they said, this is not for us. The talent is better on the East Coast, the cost of living is better, the quality of living is better. And if you go to downtown Silver Spring, you'll see Truebill sitting right out there, right across from the Metro. So there are lots and lots and lots of companies, small ones who are starting up, ones that are well-established, medium-sized companies who've decided that their next dream, what they want to do, is to be here in Montgomery County and to be next. So we talked about a campaign that was going to be more forward-thinking and uplifting and aspiring for young people, people who have been established here. And that's how we came up with the concept of you being next. You live your dream here. You be the next one to make the bold move. You be the next one to grow your business. You be the next one to hire additional employees. And that way, everybody has a little bit of skin in the game and can see the role that they play. So we're going to be running a multimedia campaign. It started this week. We're starting it out slowly in radio yesterday morning or this morning. We'll be in social media. We'll be moving into print. We'll be moving into digital media. You will see us on YouTube. You will see us on billboards. You will see us on podcast, or you'll hear us on podcast. You will ultimately, starting in January, see us on TV. And we'll be across the region primarily because so many of the people who live in the region work here in Montgomery County. So many people who are here in the region want to know more about one of the other Montgomery counties, and the most important one, because there are 17 across this country. And we need to tell our story. We need to tell it more regularly, more consistently, and with a positive image, a positive attitude. So we've got a broad-based campaign so that most people are aware of what's happening, but we are also targeting specific industries. I've just put up an example of one of the carousel ads that we're going to be running. You have the advantage of seeing what we call an A/B split test. The ads at the top are one version that we're considering, and then you see a slightly different version of them below. So we are testing these. This is for the broader community. They will roll out actually starting next week. This series of ads is tied to the hospitality industry. And we also have ads that are tied to small businesses and entrepreneurs. But the theme is consistent, that you get a chance to be next here in Montgomery County to fulfill your business dream in an area where it is good to do business and people are extremely successful here, but we're not telling that story aggressively enough or often enough. And so this is our opportunity, in addition to the other tools we have in our toolbox, to get the word out about why this is the place to be here and now. We will run across a number of mediums. This is an animated ad that you'll see running on video, and the list continues to go on and on and on. And it's also a call to action in the sense that after we've built awareness, after you become more familiar with the assets that are here and the tools that are going to help you run a business, we want to reach out to you and we want you to reach out to us. So you'll also even see a landing page on our website that is just about ready, but you will, if you go to benext.thinkmoco.com, you will be asked to fill out a little bit of information and we will reach out to you immediately. So you'll have a letter from me. We'll identify a person on our team or elsewhere in the county that's ready and willing to help you to be next. So I'm going to stop there.
Thank you, Mr. Hopkins, for that presentation. Members of the media, we open the Q&A portion right now for any questions regarding economic development and or the Be Next marketing campaign. Other questions after the public health update? Any questions about this topic? Give you a second. No questions? Going once, going twice? All righty then. Thank you, Mr. Hopkins, for joining us this afternoon. And Mr. County Executive, we can move forward now with a public health update. Please unmute.
So a little bit more before we get to public health. First, one important development for the county's Montgomery Connects program, which is charged with running our digital equity program, just got a big boost. This week we learned Montgomery County has received more than $22 million in federal and state grants to expand access to computers and broadband service and service discounts, and also pay for technology training for low-income residents and seniors. Money wouldn't be available without work of our Department of Technology and Enterprise Business Solutions, which secured the grant money. The money will be used to continue its mission of delivering 50,000 loaner computers to low-income county residents. More than 76% of Montgomery County Connect's computer recipients so far have been Black or Latino, and about 84% of them live in households with less than $50,000 a year in income. Computer distribution events also give families who qualify the opportunity to get set up with free home and mobile internet so they can better use the computers. And we've conducted dozens of distributions since the spring, giving out around 25,000 computers already. And there are still more opportunities to do this through December. So folks will be able to get free computers if you qualify. There's more information on this at montgomerycountymd.gov/computer. Equity extends to housing as well. And we talked about a little bit of this before, but this week I was invited to be a guest on WAMU radio for a forum looking at affordable housing. And it was recorded last night in Silver Spring, but it's going to air on this Friday at 1 p.m. on WAMU. Last night, I referred to this graphic of rental affordability that was put together from census data. And this is an important graph. And are we able to get it up on screen? So these are different clusters in the county, and it talks about the number of households and the estimated gross median rent in these different parts of the county. And as you can see, what we were trying to measure is if you were at the 50% percentile of white alone monthly income. So I think white monthly income is north of $130,000. That what would you be able to afford in the county? So there are only 4 places in the county where the income for a person in that group would not be sufficient for them to pay less than 30% of their income for housing. And it's 31%, 32, 129. I think it's a glitch that it got included there, but basically most of the county is affordable to white residents who are at 50% of the income, in the 50 percentile of income for white folks in the county. And the Asian community, pretty similar. There were 6 parts of the county where people at that level would be income burdened. Now go to the next column, which is Black and African alone, and their monthly income, which is around $75,000. So it's significantly less than white or Asian incomes. There's only one place in the county where people at that income level could find affordable housing, and that's Tacoma Park. And if you go over to the next column with the Hispanic community, same cohort of people by income, again, the only place in Montgomery County where those folks could find affordable housing is also Tacoma Park. You want to know what's different about Tacoma Park and every place else in the county? Tacoma Park's the only jurisdiction that has rent stabilization. So we've been able to keep housing affordable to a larger portion of the county than anybody else has, and the county has as a matter of policy. But it's a good, I think if you look at the data in there, it gives you a good idea of how rent burdened these folks are and what a serious consequence that has. So as we look at housing policy, we're looking at data like this to help us figure out what it is we're going to need to do. The numbers in red mean the renters are house burdened more than 30% of their income for rent. And that, by the way, is the cap of what you're supposed to spend, not what you're supposed to spend. Anything over that is considered excessive. As I discussed on COJA, our housing policies have been in place for many years, and they're not stopping the loss of naturally occurring affordable housing. If you don't have any controls on it, if you don't have a no net loss provision, when you redevelop property, the only way for that, for how affordable housing to go is to go down. And some of our policies are actually accelerating that loss. When we do redevelopment in areas and we take down a low-rise building, and we've got multiple examples of this, Bethesda, and when the new building goes up, all we get is 15% affordable. The 15% new affordable units is fewer than the affordable units that existed there before. That is a problem. And if we continue along those lines, there will not be much affordable housing left in this county. And as I discussed, our policies, were in place for years. The MPDU program is Montgomery County's most significant program. And we talk about it, with great pride, because we were probably the first county in the country to do this kind of inclusionary zoning. But the problem is, pretty bluntly, that the program that was developed in the mid-70s is not a program that works for the population today. If you were to look at a map of, or not a map, but a data on Montgomery County population in 1970, the county's population was about 95% white, 4.5% black, and then 0.5% all other. That's 1970. And obviously the county's radically changed since 1970. Our policies have not. When they created the moderately priced dwelling unit program, it was referred to as a program to provide housing to our firefighters, our police officers, and our teachers. They were the low-paid folks in the county at the time. World has changed, and we have today, almost 50,000 households who are in less than $50,000. They don't qualify for the MPDU program. In fact, they qualify for no program. And when we require new affordable housing, unless we work out special deals or unless we have leverage, such as using county property, we don't get more than 15% of new units as being affordable. This is a major problem. It contributes to loss, but it also contributes to the growing gap in affordability for people. So the MPDU program needs to change, and we need to address the affordability issues with strategies and policies that will actually provide affordable housing. And I'd say the difference is, under Thrive, some individual homeowner has to decide that they want to tear down their building and build something else. Our policies are aimed at the large parts of the county where we have massive properties zoned for redevelopment, where we have the ability to require that whatever is redeveloped meet these goals. And we're talking about projects, as I think projects that sometimes number 1,000 or more units. So these are opportunities for us to make policy decisions that will have a broad impact across the county and not rely on voluntary decisions. Voluntary decisions are not going to get us there. And even if developers built all the allowed housing tomorrow, it would not solve this affordability problem. So we were told, one of the studies that we were given to look at a few years ago, that 3/4 of future residents by 2030 will not be able to afford market housing. And almost 50,000 existing residents can't afford market housing either. These 3/4 of people coming here by 2030 would equate to about 30,000 people who will not be able to find affordable housing here. And so just do the math. If all you get is 15% of development as affordable, and I build 40,000 units, I'm going to wind up with 6,000 affordable units when the need is pretty clearly on the order of 30,000 affordable units. I've been trying to make this point over and over again, that our policies do not work and will not work unless we're willing to make some serious changes. So we're going to move forward with, a kind of three-pronged approach to dealing with this, both housing preservation, protecting housing where it is, and producing more affordable housing. And we're proactively working with developers and nonprofits and communities to create more affordable housing. When our 18 properties and 19 properties are put on the market, they will be focused on affordable housing. Affordable housing will not be the small part of the project. Affordable housing will pretty much be the project. We're also going to move forward with no net loss legislation, so that if you're tearing down affordable apartment buildings, you have to replace the number of units that you demolished on a one-for-one basis, plus your total project has to meet the county goals to produce more affordable housing. So the starting point will be no net loss, and then we look to claim more units out of the units that are produced above what they're replacing. And we've already put in record funding to create more affordable housing. We're going to look at modifications to right of first refusal to make sure we can act quickly when properties come on the market. And we work with our nonprofit partners in order to do this, and we're going to keep doing that. And we've mentioned before, we've got 18 properties right now that are currently primarily parking lots that we're going to look to replace the parking, but also provide affordable housing there. And I'm going to continue to advocate that the council pass a rent stabilization bill. There are plenty of jurisdictions that have it. The District of Columbia has rent stabilization. If you don't have it, you will lose the housing. I mean, I don't know any other way to put it. It's happening all around us. Arlington's had an enormous loss of affordable housing. The district's had a loss of affordable housing. If we're not willing to take some positive action to preserve it, we're just not going to have it. Now, with the media coverage, and the turmoil and the problems within the planning board right now, we don't want to lose focus and attention to the systematic inequities and lack of affordable housing for people who live in the county, as well as people who will be coming to the county. I'm in agreement with people that our zoning is a problem to some extent, but we need a solution that actually produces housing and not just simply moves the cheese around on the table. So I think you'll be hearing a lot more from that as we discuss it. And you'll be seeing legislation coming out of us pretty shortly. Also in the news today, the reports of the federal lawsuit filed by the Sierra Club of Maryland regarding the I-95-270 toll project. The lawsuit argues the state bypassed key review processes in an effort to jam this unnecessary project through as quickly as possible. And this is too big a project to do sloppy work on. And I want to reiterate something that I've said from the very beginning. We're not trying to stop traffic relief. We're trying to make sure that we build a project that delivers traffic relief, but isn't blown up and made the most expensive project in the world just to say we have the most expensive P3 in the world. We think there are ways to address the traffic. We agree about providing capacity on 270 on the western part of the Beltway and dealing with the American Legion Bridge. But we want to make sure it's done the right way and doesn't cost residents any more than it's going to need to cost residents. But this is doable. I've always believed that it was doable to get the lane capacity we need. It's just a matter of how you get that lane capacity and what the impact is. And are you building things that are just way overblown to achieve something that you could achieve otherwise? So we're going to continue to work on this. And I hope the Sierra Club's successful. I think everybody knows that we have a new administration coming in, and that administration ought to be given the chance to look at this project. I know I've talked to Wes Moore myself. He's as committed to doing something as I am. He's as committed to doing something as the advocates for this project, who I don't agree with, are committed. So we don't lack a commitment to doing something. The question is, what should we do and how do we do it in the most cost-effective way possible and the least invasive way possible? And that's our intention. On COVID news, new variants are starting to appear in our community, but case rates remain around 80 cases per 100,000 people. The BA.7 variant is showing up as BA.5 concerns begin to fade. Both hospitalizations and rates of positive cases have fallen significantly, keeping our community status as low. One thing that has not faded, though, is the number of serious illnesses tied to COVID-19. When you combine deaths from flu, COVID, and pneumonia, are still 30% higher than we would normally be. That's one reason we're encouraging everyone to get their flu shot and COVID booster at the same time. You know that many people already value the importance of immunizations. Sean has some new graphics that he's going to share with you today when I turn it over to him. And we're very concerned about the correlation between COVID and respiratory illnesses. Getting dually sick with COVID and the flu will present real challenges for people's respiratory systems. And we know that, flu kills tens of thousands of people in this country every year. Combining that with something else which has the potential to disrupt your respiratory system will not make those numbers go down. As we're a month and a half into the new school year, I've really been impressed by the efforts of MCPS and our HHS department to keep our schools safe and healthy from COVID. New numbers show Montgomery County has the highest school immunization rate in the state, with kindergartners, seventh graders having a 97% compliance, and 99% of eighth graders in Montgomery County are compliant on their school shots. We can't emphasize enough how important it is for parents to ensure their kids receive all their vaccinations. And we're going to continue on our strategic outreach engagements in the school community, where people may be lagging behind in vaccinations, and as well as in the general population. We still have too many adults who have not been boosted. And the new booster, the bivalent booster, actually gives you protection against Omicron and to a degree that wasn't available in the previous booster shots. Finally, in other good news, not quite in its final stage yet, but the FDA has approved the new bivalent vaccines for children either 5 to 12 or 6 to 12, depending on the vaccine. And they're poised, they said, to get 7 million doses or 6 million doses could go out in the week. But you first have to get approval from, I think, the Center for Disease Control and then from the state of Maryland. But as soon as those approvals are in place, and I would anticipate they would follow pretty quickly from the FDA, we should be prepared to give our young people that added protection that comes with a bivalent booster. And finally, monkeypox, or MPX, was once again the focus of the virtual town hall this week. This conversation focused on the Black community. It was the third forum the county's held to answer questions about MPX. Concern remains elevated for Black and Hispanic men, even though cases have leveled out statewide and locally as well. And I'm now going to turn this over to Sean O'Donnell, Kimberly Townsend, and Dr. Stoddard for more on these health threats. Thank you all very much.
Thank you, Mr. County Executive. So again, to move through our COVID update, just to remind everyone that we are still tracking the variants, including some of the newer variants. Again, as our county executive shared, our transmission rates have been decreasing recently. So we haven't seen a huge number of these variants transmitting currently in the community, but we are, of course, monitoring what's going on throughout the country as well as internationally. Again, with falling rates, we're seeing lower hospitalizations as well. Some of our lowest hospitalization rates in quite a while. The way we would have described over the last few months, we've had a fairly steady level of high transmissions, and those are actually coming down now, as well as the hospitalizations. About half of our patients in our county who are in a acute care setting or an ICU setting with a COVID diagnosis, about half of them are over at the alternate care site at Tacoma Park. Again, as we see these rates fall, we are hoping that we will see more serious illness decline too. I said we've seen hospitalizations go down. Unfortunately, we have not seen the deaths go down yet. Again, this is really just demonstrating that we've been at a fairly high level of transmissions with, unfortunately, a degree of mortality associated with that. That's been fairly consistent at about, unfortunately, a death per day over the last few months. Again, in tracking our data, we are still seeing a disproportionate number of more serious illness happening with our small number of unvaccinated residents. So we continue to encourage them to consider vaccination. And we continue to offer vaccination not only at a very large number of private sector partners, but also at county vaccination clinics across the county. As we look at the continuing group of people, mostly who are coming out for boosters now, that is the bivalent boosters for everyone 12 and up. You can see from our chart here that that's what a lot of the vaccinations currently are, is those who are 50 plus who are getting a second or in many cases a third booster now, and those that are under 50 potentially getting their second booster. Again, because everyone 12 and up is eligible for this bivalent booster at least once. Again, I just want to point this out because I'm going to move on to some of our influenza information in a second. But obviously, as we've been talking about for the past few months, our booster rates are much higher as you go up in age. Again, these are the populations who are at greatest risk from COVID, but we do encourage everyone to get those boosters, both to protect themselves from potential long-term effects of COVID, from extended illnesses or possibly more serious illnesses, but also to help reduce the chance that you could spread this to other people who are at greater risk. Looking at influenza data, just to put this in perspective, this is the last year's worth of data across the United States. You can see two very large spikes, and they appear to correspond almost at that gap between the two spikes seems to overlap with the really, really large Omicron spike. And it may be that so many people last winter were becoming ill from Omicron or starting to shelter or reduce their contacts because of the widespread of Omicron last winter, that it may have reduced some of the influenza season that is more generally a larger spike. But then the second large spike there corresponds with when the county had some lower periods of COVID activity. So likely people resumed their activities with lower COVID transmissions. This is really just to help people be aware that that influenza can continue to spread and other respiratory diseases can spread even when we don't have a novel COVID variant that is impacting us. And you can see from the far right, the data across the US that they're starting to see those influenza positive specimens go up. So we are likely at the beginning stages of the flu season here. Again, to put in context, as we talk about where we are with COVID and where we are with respiratory disease, this is information from the CDC where they plot out the seasonal curve of what is usually respiratory disease, usually pneumonia and influenza. And you can see they expect it to rise during certain seasons and then fall between the seasons. The total, this is the mortality data. This is deaths related to those diseases. And most of them are related to pneumonia previous to COVID. And you can see that if there is a season where there's unusually high activity and related serious illness and death, it's above what the CDC would call an epidemic threshold. You can see the blue peaks are COVID being added into pneumonia and illness, influenza illnesses for mortality. And you can see during that period of COVID, we've been well over the epidemic threshold. Obviously, we've been in what we're calling a pandemic. Even with the lower level of COVID over the last several months, you can see that we're still in what would be characterized as an epidemic threshold by the CDC definition. And again, we're hoping eventually to be able to bring these down, this most serious illness that results in death, bring this down to below those pre-COVID levels. Again, we're just sharing this now to provide this in context. The CDC has evaluated that the data as of September 29th, 8.7% of the deaths that occurred during the week ending September 24th were due to pneumonia, influenza, or COVID. So that is a much higher rate than what they would normally expect in a year, which is closer to about 5 to 6% of deaths related to those sort of respiratory illnesses. Looking at where we are in Maryland with influenza vaccinations, statewide, about 8% of the population has gotten their flu vaccine. I know we're kind of at the beginning of that period, but that's a great time to get the flu vaccine and protect you throughout the next year. Montgomery County is closer to 12% having the flu vaccination. So again, we hope these numbers will continue to go up over the next few weeks. And if you look at the lower right, you can see the age spread of vaccinations for flu, and it very much looks like what we see with COVID, where our older populations are more concerned with the outcomes due to flu, and as they should be, and are getting those flu shots. But again, everyone is recommended to get this of all ages. Now I'd like to turn it over to Kimberly Townsend to give us a brief update on our MPOX cases and response.
Thank you, Sean. Good afternoon. So as you can see here, we are still seeing some new cases nationwide and within our state. We have 682 cases in the state of Maryland. So we are continuing to monitor and our mitigation strategies, as this does indicate we are still seeing some transmission. The good news is, as you look at the 7 daily average case reports of MPX, we continue in a downward trend, and we hope we'll continue to see this downward trend over the next several weeks. So we have 83 cases identified in Montgomery County as of the 3rd of this month, and we vaccinated just over 2,200 Maryland residents for MPX, which accounts for about 30% of all those vaccinated in the state of Maryland. To your right, you can see that we still have some communities that are being impacted that we are going to continue to outreach to so that we can get them in to be vaccinated. We do that, of course, through our town halls, our outreach, and of course, collaboration with our community partners. And then finally, we continue to provide vaccination to our 3 priority groups. We continue to provide vaccination at 2 different sites, Monday through Friday. We still have vaccine enough available to provide it to those that are eligible for post-exposure and pre-exposure under the current criteria. And as mentioned earlier, we did have the 3rd in our series of town halls on Monday evening. We hope to be thinking about and planning for additional town halls in the future. And with that, I will pass it back to Lorna.
Thank you very much for the public health update. Thank you, Mr. County Executive. Dr. Starter, do you have any opening comments, or should we transition to Q&A?
Just go to Q&A.
Okay, thank you very much. And I see first set of questions from Stephanie Ramirez, Fox 5. Good afternoon, Stephanie. Still here? She might have dropped, although I do see Fox 5 here. She might be back. I do not see any more question requests from members of the media. We'll give it a second or two. Please use the chat. Kevin Lewis, ABC7, questions for the county executive. Good afternoon, Kevin.
Good afternoon. County Executive, rumors are swirling around that the council would like to, for lack of a better term, clear house with the planning board and start entirely fresh. Have you heard these rumors? And what's your opinion about the state of the planning board?
A bit of a mess. And I've heard rumors, but I haven't myself been contacted by anybody from the council. So rumors, I don't know what exactly is, the reality in the moment. I understand they'll be probably saying something later, but I do think, there's certainly a need to do something. And I just hope that, everybody's thoughtful about what they do and that they take into account, what people did that would trigger you to make such a decision. Then I'll wait to see what they actually announce.
Obviously, the executive and the council has control of the planning board with the appointments. But if you were still a council member, do you think that it's best to wipe the slate entirely clean, or to wipe 1, 2, 3 individuals and keep some institutional knowledge?
If I thought everybody was equally responsible for things, I would wipe the state clean. I don't know enough, because I'm not privy to investigation, to know whether everybody bears responsibility for this mess. But I don't know if I'd wipe it clean on general principle, but I'd certainly There certainly needs to be change, but without knowing who did what at this point, I'm not totally sure about where, if I couldn't tell you specifically what I do and how I'd look at each individual case.
And from a county, we had the gentleman talking about businesses coming to Montgomery County, and from an economic standpoint, a development standpoint, if the entire planning board is wiped out, even if it is, my understanding is the council would then call for applications and then would review applications and appoint a new chair and 4 new commissioners. Should there be concern about like the wheels of progress coming to a screeching halt here, or will business kind of continue as usual?
I think it'll be pretty close to usual. I mean, they've got the ability to appoint an interim board while they review candidates for the long term. And, a lot of the people who really do the work every day are the staff, and the staff are still pretty much there and intact. So if they've got cases they have to look at, or, data they're trying to formulate, or staff's trying to make presentations, I imagine all that would continue to go on as normal. So I don't see any reason if this, if they're expeditious about what they do, for this to cause, any serious delay. And, we do think, we'll also be talking about what we think are changes that we could make in processes. This may be a good opportunity to talk about what other good things we could do in terms of structure and organization that would be beneficial to making it easier to grow and develop successfully in the county.
Okay. And of all the allegations that have made it into the news media over the last month or so, well, I guess even longer than that, if you're talking about the alleged Open Meeting Act violations, was there one allegation or one story that really just made you say, "Oh my God," compared to all the others?
Frankly, the Open Meetings Act violations, not just because they were violations, but because of the chair's kind of like, you have no right to do this, you shouldn't be doing this, I know better, I should be. It's like, it's one thing to get slapped and be told, okay, you did something. I've seen lots of, this isn't the first time anybody's ever been accused of an Open Meetings Act violation. Usually people say, yeah, we didn't realize it, or we'll correct it. But the kind of defiance that he displayed was the most problematic thing to me. And the fact that he then repeats it multiple times, it to me is problematic.
All right. Lastly, should all of this, in your opinion, put Thrive on the back burner, or do you feel that Thrive can carry on should the whole planning board resign or be terminated, whatever the individual processes are?
Actually, I thought this should have been paused, regardless of whether or not the whole planning board. This is not, at this point, it's not a planning board issue. It's a council issue. And I'll point out, they just had this racial equity report. People like to point to, there's they said like Black residents, 73% agreed with the objectives of Thrive. If somebody asked me the question they were asked, you would have added me to supporting the objectives of Thrive. But they didn't ask they didn't actually get into educating people about what the actual policies of Thrive were. And when they asked that same population questions later about, do you think these policies will actually work, they got a very different answer. And I'm more interested in the answer when you ask a resident after I tell you, do you think this is going to work and solve the problems? And if they tell you no, or they don't understand what the actual policies are, that's a much bigger problem. I think they've got a big problem in terms of public outreach. I think they've got a major problem in terms of equity. Nobody's analyzed the actual work itself. Nobody took it upon, even when they hired the contractor was only given enough money and enough time to survey people. He wasn't given time, to educate people, but he also wasn't given time to analyze the recommendations to see whether the recommendations would lead to less segregation or more segregation. I happen to think that some of the regulations or recommendations would increase segregation in the county and increase the disparities between white and minority populations. And I will just to distance myself from one train of thought, I don't believe, like some residents do, that this is going to destroy their neighborhoods in terms of, who's going to be able to move there, because I'm pretty sure that, from Park and Planning Zone research, that the housing that they would produce in this little adventure into neighborhoods would be more expensive than the housing that's there right now. I think the biggest problem is if they're masquerading this as an affordable housing solution when it actually doesn't address affordable housing. There's very prominent language in there where they talk about the purpose of attainable housing being to help people find unsubsidized market housing. And then they go on to say that it's time for the county to end its sole focus on affordable housing. And if anybody thinks the county's had a sole focus on affordable housing, that's a joke. Our most vaunted program, the MPDU program, has 6,700 units. 67, just picture that. The need in the county, 50,000 households under $50,000 can't find affordable housing. 3/4 of the people projected to come here are going to need affordable housing, and the MPDU program serves people between $60,000 and $75,000. It's not a solution.
Well, thanks for all of that, and we'll buckle our seatbelts and see what happens later today.
Fortunately, you're not on the roller coaster.
Just watching from down below. All right. Thank you very much.
Thank you, Kevin. Any other questions from the members of the media? I do not see any more on the chat. We'll give you a second. See if anybody else has any additional questions today. Guess not. Going once, twice. Well, we're done for today. Thank you, everybody, for joining us. Have a great, Mr. County Executive, you wanted to add something?
I just said thank you.
Well, thank you. Have a great afternoon, everybody. Stay safe. Bye-bye.
Bye.